But with endoscopic spine surgery, this is a surgery that can be done outpatient now. These patients can literally leave the same day and get back to their normal activities within 2 to 4 weeks. So, I mean, when I say that endoscopic spine surgery is changing the game, I mean, it is. It's like, I don't know, like Super Nintendo to PS5. I mean, it is changing the game. This is a different type of experience for patients.
Hello, friends. Welcome back to the Attorneys on Accident podcast with your hosts, Joe Wirth and Ash Blackburn. We are sitting down today with Dr. Kevin Sharif. We are going to be talking all things robotics, robotic surgery, where it's headed. Is this the future, or is this maybe just more, innovation wrapped in clever marketing? We're going to be asking some hard-hitting questions, Dr. Sharif. So I hope you're ready. This isn't going to be just a friendly game of softball. Hey, you ready for this?
Absolutely.
I'm going to because you're charismatic and can talk to anyone and work a room, I'm going to hand the mic to you to introduce yourself, give us some background before we jump into the questions.
Thank you.
All right.
And I just want to say, I really appreciate the opportunity to come on the podcast. I've been really looking forward to this. So yes, I'm Kevin Sharif. I'm a minimally invasive spine surgeon here in Las Vegas. I've been treating patients with spine issues for about 10 years. My training is a little bit different than most spine surgeons. I was actually fellowship trained in not only orthopedic spine surgery, but also neurosurgical spine surgery. Mm-hmm. So I really feel like it gives me the opportunity to see things from both sides. I see things from a biomechanical side as far as the structure and alignment of the spine, and also from a neurologic side as far as what is exactly causing the pain when it comes to nerve impingement and upper and lower extremity issues.
Love that.
Give us a little bit about your background. You've been doing this for over 15, 16 years now. Over 1,000 robotic spine surgeries.
Lots of minimally invasive spine surgery.
Okay.
Yeah.
Okay.
And that's kind of my focus.
Okay. Yeah, that is your focus. I mean, that's really why we wanted to have you come on, is to educate listeners on, is this the self-driving car that everybody's kind of hearing about? They're a little nervous, and then a friend does it that you trust, and then you do it. The next thing you know, you're putting on your makeup and you're like, this is the best thing ever, right?
Sure.
You're cheating the system. Is this just like you're ahead of the curve, or is this a way for you to differentiate and stand out in a crowded market where it's competitive and everybody's got back pain, and you're like, okay, well, this is something I can embrace? And
so I'm glad you asked that, because there's a story to that, right?
Okay.
So I came to Las Vegas, and what I found was that spine technology in Las Vegas overall, what the hospitals were offering were antiquated, to be perfectly honest with you.
In what way?
Well, where I trained, we had 3 O-arms. So what is an O-arm? O-arm is navigation. It's not the self-driving car, but what it is it tells you where everything is when it comes to spine surgery. So you can make smaller incisions, and you can be very precise in where you're placing your instrumentation, your screws, your rods, your cages, all of that. And that's very important when it comes to minimally invasive spine surgery. And that's my focus, but also deformity. So I'm a deformity surgeon as well. I don't do as much deformity as I used to. I've focused more on minimally invasive, but early on, especially when I came to Las Vegas, I did a lot of deformity surgery, pediatric deformity as well as adult deformity surgery.
So are you talking about, just so our listeners understand, like the presets where you're looking up the image, you can place the hardware, push a button, and then the robot places it?
No. That would be much more advanced than what I was even seeing in Vegas, what they didn't even have. Robotics is a completely different level. We're talking just basic. We bring an O-arm or an intraoperative CT scan into the operating room. It takes a picture of the patient's body. And then using what we call stealth navigation, we have these trackers in the room and these cameras. And this is technology that's been out for many, many years. And many hospitals have them, especially in major metropolitan areas. And this was, 10 years ago. And I expected to have this type of technology in Las Vegas, but there was only one hospital that had it at the time. And it was a hospital that was way in North Las Vegas. And the only reason they had it there is to try to attract surgeons to come all the way out there to bring their cases. So everything was being done like, early 2000s, 1990s.
Old school.
As far as, old school works. There's no doubt about it. But
medicine, I don't know if you went old school.
Well, listen, technology continues to evolve, right? And you evolve with the technology, or you're like a dinosaur. So when I came to Vegas, I started working at a certain hospital, and I asked right away, I was like, is there any possibility that we could get an O-arm here? Because I can do these surgeries. I'm trained, so I can do these surgeries without an O-arm. I can do them without X-ray. I mean, I'm trained as a deformity surgeon. I can put these screws and the instrumentation in and just take an X-ray at the end of the case. That's the way I was trained at the Leatherman Spine Institute. So that wasn't an issue, but I wanted to take it to another level, and I wanted to do more minimally invasive cases. And when it comes to minimally invasive spine surgery, you have to be very precise. You're not seeing all the anatomy, all the landmarks that tell you exactly where things need to go. So navigation and now robotics can really help you get there to do these surgeries with smaller incisions and a quicker recovery. So I had several meetings with the hospital CEO. We had dinner a few times and we talked about this back and forth. And one thing he told me after a year in the hospital I had been working there, he said, you know what, I feel like we could do this in a couple of years. This is not a year one type of endeavor. This is a major investment that the hospital have to make in this type of technology. So a couple of years went by, and I reapproached the administration. And at that time, robotics was just coming into vogue. So when we sat down and had that conversation, and he asked me, you've gotten a lot busier. He was like, your outcomes are phenomenal. Everybody loves you at the hospital. He's like, what can we do to take us to the next level? I remember you wanted an O-arm, you wanted navigation. And I was like, that's what I wanted yesterday. But what I want today is a robot.
Yeah, that's like your kid, like, yeah, that video game console's outdated.
Right. Yeah. So we end up getting the robot. We got the Mazor Stealth X. It was the latest and greatest robot at the time, and it really still is. It's like, really cutting edge technology. We were actually the first hospital in the Valley to get this type of technology. And I was the first surgeon in Henderson that operated with the Mazor X Stealth Edition.
Well, you got stealth in the name. You can't.
Right. It sounds super slick.
Your wife's like, baby, you working with that stealth?
Oh my gosh.
Stealth.
But I'm curious, okay, so if the O-arm gives you better ability to see what you're working with,
Right.
What does robotics do?
So robotics takes it to the next level. So not only can I visualize the anatomy on a computer screen, it's almost like playing a video game, so that I can plan the surgeries out before the patient ever hits the operating room. I know exactly what we're going to do. I know exactly what implants we're going to use, the size of those implants, the cages. And then it also has AI technology where we can predict what's going to happen with the spine when we make certain interventions. If I place this cage in with this amount of lordosis, how much am I going to be able to correct this spondylolisthesis or slippage of the spine or correct this deformity? I can plan that, right? So what it amounts to is when we go into the operating room, we've got a game plan. We know what we're going to expect. And I think that's so important in spine surgery to have predictable outcomes. And I think that, that's one thing that's kind of hurt spine surgery in a way in the public perception is, you just never know what you're going to get. Some people come out good, but Mr. Smith came out bad. I don't ever want to do that. So what I'm trying to do is I'm trying to take spine surgery to a place where it's less scary, right? The outcomes are more predictable, and the robot using the artificial intelligence is helping us get there. So when we get to the operating room, we are executing the plan. The robot doesn't do the surgery. It's almost like the autopilot where you got to keep your hand on the wheel, right? It's not quite like the Tesla where it just drives you around. The robot is an assistant. The robot shows us exactly where the implants need to go, and then it helps to guide the implants into place.
Is it like a commercial plane where it's like, you're like, the pilots hardly do anything other than kind of land, take off, but they're there. But they've got to land the plane, they've got to take off.
No, it's really less than that. You are still doing the surgery.
Okay.
But you're doing it with the assistance of the robot. The robot does not put anything into the body.
Because I think some
The
people,
surgeon is putting everything
they
in.
jump ahead, right? We're talking to clients and we mentioned, hey, these doctors, their practice focuses a little bit more on robotics. Their mind just goes straight sci-fi and they think the robots, Star Wars, they spit picture you going in an enclosed case and it does the whole surgery.
Right.
I'm imagining my Genesis, right? Where like I can put it on cruise control, still have to have the hands on the wheel, still have to be kind of navigating. But if I go too far out of the lane, it assists.
There you go.
There we go.
Or it won't let you hit the car in front of you.
Yes.
Right?
Emergency stop.
It's more like
Okay.
that. It's more
Okay.
like that.
Keep
I'm
their
sorry.
analogies. It's not cool. Give me one on the next.
Okay, I'll
next
swear it to you.
podcast. So let me ask you this: is this something where, yeah, I mean, it is competitive, right? Spine surgery. I mean, this is something where
You could say that.
there's nuance in it.
I feel like I'm competing with my own outcomes. That's how I feel.
Okay. I mean, but you use it to market, right? I mean, you
Sure.
get it on your Instagram, and it's something.
You know, it's interesting you say that. So I thought getting the robot was going to be, I felt very confident in my ability to get patients better. I got the robot 5 years ago. So before that, I've done over 1,000 surgeries, right? And, I have a good reputation, 4.8 on Google.
That's not easy.
Well,
Nice.
it's spine surgery, man.
Crazy.
I don't trust it if you're a 5, especially
You
if it's
shouldn't.
spine
And I
surgery.
tell patients that,
So
like,
4.8
you need,
is
right,
nice.
exactly.
We
This
can't
is
go down
real.
that road.
Yeah.
The reviews will get any business owner off the couch.
This is real.
Yeah.
Anyways, I feel very confident in my skills and my ability to get patients better. And I thought initially, I was like, I'm bringing new technologies to Valley, right? This is going to be great. And just from a marketing standpoint, I'm the first spine surgeon in Henderson doing robotic surgery, right? And I knew, I knew it would be helpful, but I didn't understand how it was going to change my practice. I didn't know at the time.
You didn't know everybody
It's completely changed my practice, but not from a marketing standpoint.
Well, have you lost all your friends? Like, I mean, is there this kind of bias, right? The old guard, is there a threat at all that these other spine surgeons feel in terms of, well, no, it's not as good and it's not really the future?
I think that surgeons in general, let's talk about outside of spine surgery, surgeons in general, everybody is kind of set in their ways. They're like, I've been doing this for 25 years. This is how I get my patients better. And they know what they know, right? But what I saw in my practices, what it allowed me to do, it allowed me to transition from a mostly open practice of spine surgery, meaning that, I made incisions as small as I could, but they still need to be a certain size. I needed to see everything. I needed to make sure these screws are going exactly where they needed to be. These cages were placed according to the anatomy. But with robotics, I've transitioned from a more traditional spine practice, and I'm like 100% minimally invasive now. So I'm doing these surgeries where patients used to stay 3-4 days in the hospital. Now they're leaving the next day.
Like a fusion, like a spinal.
Like a fusion, like a one level transforaminal interbody fusion. That's a common spine surgery that most spine surgeons perform.
So benefits, less blood loss.
Less blood loss, less risk of infection, less risk of malposition of implants, quicker recovery, and a shorter hospital stay.
What would critics or competitors say as far as like, okay, it's not all just positive. I mean, are there any drawbacks? Is there any downside to it? I mean, because if it's everything you're saying, then why wouldn't everybody embrace it? But I've always done it this way, and I'm not open to.
Does it cost?
There's a learning curve. There's a trust factor, right? Like, we have a Tesla, and we have autopilot. I didn't trust autopilot for a while, and I'm still a little bit like
right out of the gate. There's probably something wrong with you, because my wife has fully embraced it, and the first couple times when she put it on Mad Max mode, I was just like, we're really gonna make it over on that off ramp, and she's just like over there, like reading a book, and I'm just like,
yeah, right.
I didn't trust it.
I didn't
there's
either.
A learning curve.
There's a learning curve, right?
Yeah.
So even when I started using the robot initially, do you know how many X-rays I took? I took.
Like,
I
are
was
you
like,
sure?
You sure? Like, I'm about to put this screw in
I'm gonna do one more.
because you're saying it's right here. All I'm trusting is the robot and what I'm seeing on the screen. That the robot's showing me on the screen what's happening. But do I trust it?
Yeah.
And then over time, and there's some nuances with using the robot and things like that, obviously. And then there's other nuances with just performing minimally invasive spine surgery. But once I saw that the robot could help me make smaller incisions, it was just off to the races. It was like everything's minimally invasive now. My decompressions, the fusions, the putting the cages in. I just completely embraced it. And what happened initially is my surgeries took longer. And a lot of surgeons they won't make that sacrifice in their efficiency. They won't make. So I started out, my transforamen interbody fusion open. I could do that open in about an hour and 45 minutes or so, which is a pretty good time. You don't want to keep the patient on the table too long. You want to be efficient, get the job done right. And then as I started doing minimally invasive surgery, it was taking like twice as long. So I'm booking less cases for the day.
Okay, so
right?
there's that, so then you're losing money.
Right. So there's
short term.
Exactly, in the short term. But the gain, when I saw the outcomes and patients would walk into my office and I would try to write them at 2 weeks. And I'm thinking, oh, you got to, the prescription for some Percocet. Like, you know what? I don't need that. Stop taking that last week. I'm like,
oh, wow.
You did? Like, yeah, I took it for a couple of days, but doc, my back feels pretty good. My leg pain's a lot better.
And you're trying to play cool, like, oh yeah.
Yeah. Well,
I knew that.
it's minimally invasive robotic AI surgery. So these are the outcomes that we expect.
Did you
but
feel like
I was a little surprised myself?
But was it like being baptized? You want to spread the good word? I mean, you probably still feel that way, right? Like you're a big proponent. You want to get your
absolutely.
How has the time differed now that you've kind of been doing it?
Now the surgeries take less time than they did open.
But did that take months, years?
That took several months.
Okay.
It took several months.
Are they teaching robotics now?
So that's interesting. I think that things are changing, and it's kind of it's almost like the transition from a manual transmission to an automatic transmission. And I'll explain. You want to be able to do spine surgery without the robot.
Right.
Like if you need to, change gears and hit the clutch and that's the car that you have and you have to drive it.
Yeah.
You want to be able to do it. Right. But now there's so many people that I learned how to drive a stick. Like when I was 16 years old,
I'm with
I had a Mitsubishi Eclipse.
Oh yeah, don't
saved up,
stick.
paid for it myself.
Like a point of pride, like
Yeah.
you guys in the stick club? Yeah, I can drive.
You can drive a stick, right? So it's for a spine surgeon, in my opinion, you still want to you don't want to be limited by the machine.
Right.
You want to be able to do these surgeries on your own. So right now in spine surgery, what we're seeing is like, these technologies are enabling technology, but are they also disabling in a certain type of way?
That's the question I want to ask. Right. I always hear, like when Ash and I are pretending to be doctors and taking depositions of people like you in our profession, it's the common phrase, right? Doctor, medicine is both an art and a science, right? So do you see robotics as starting to remove the art, and what happens when you do that and it just becomes like this lost art when you don't have the years of surgical feel that you developed and the instinct and those types of softer skills? Do you worry about that to where it's like, okay, if we're just teaching robotics,
well, here's what I worry about.
That kind of dexterity.
I worry about when the robot doesn't work, when the robot goes Windows 95 blue screen in the middle of the night.
I was going to ask. I was like, is it malpractice or product defect?
And you're the spine surgeon that only use robots in training, and you're like, Control Alt Delete.
Yeah. Did you try powering on and powering off?
Just unplug.
Well, that's always the first thing IT tells you, right? Yeah. So there's that part. So if I were a spine surgeon or an aspiring spine surgeon looking for a fellowship, I would look for a fellowship that wasn't a prominent part of my training. I want to know how to do a spine surgery well with my hands, my eyes, and an x-ray machine only.
Yeah.
That's what I want, because that's the basics. Every hospital has that. Every surgery center has that. And that's the basis of spine care in the operating room.
Yeah.
But I think that, embracing these technologies is important, because I do think that it helps benefit and advance patient care.
Okay. Where are we at globally, competition-wise? People always want to know where America kind of ranks. I mean, has Europe embraced this way ahead of us, China, other places?
It's all about regulation. So that's a really interesting segue to something that's happened just recently. So
what's that?
How about this? And I posted this actually on my Instagram channel. Sharif, spine specialist. If you want to check that out.
By the way, let's do a quick plug. We usually wait to the end, but like Dr. Sharif's Instagram, he's not shy. Like it's fun.
You want to see a spine surgery. That's
somebody
where
like there's the memes where it's like the older generation when they realize they have to embrace, social media to market. And this is like, oh, that feel me now. maybe your personality has just always been fun and outgoing, but
I appreciate
or you're a really good actor.
Yeah.
Which is it? 'Cause it looks like you're having a good
Actually,
time.
so I really enjoy what I do. I'm one of those people, and I feel like, and you can relate, I've found my piece in how it fits into this puzzle we call life.
Okay.
Right. So I really enjoy what I do. And this social media thing, it's almost like another part-time job. Right.
Yeah.
And every job is not easy. Right.
Yeah.
But I enjoy the outcomes. I enjoy the outcomes.
Good. Well, that's
Yeah.
good because you can tell, right? Like
Yeah.
if somebody's doing it and they're being forced, like it's going to translate. Yeah. So, anyways,
So
Check 'em
Europe versus
Yeah.
America, right? So I had this a situation that happened just maybe 2 weeks ago where I saw a patient in my office, and every surgeon that she had seen in the community had offered her a fusion. And she's very educated. She had done her research, and she wanted a lumbar disc replacement. That's what she wanted. And when she came to the office and she told me, she was like, yeah, I looked at her MRI and everything. And she told me that everyone's been offering me a fusion, but I really want a disc replacement. So she's kind of like shopping around a little bit, trying to figure out like who can I go to that can kind of, but a savvy customer, right? A savvy customer, which is important. And I think that if you're thinking about surgery, you should be a savvy customer. You should be a very savvy customer. I mean, how savvy are we when we go and go shop for a car or something? Like an
Know
investment.
exactly what coffee I want, how I want it to be.
There you go. Another better analogy. Stop. Come on.
Shop for a house, all these things. This is something permanent that's being done to your body. We need to be savvy. We need to shop. So I encourage patients to get second opinions. There's nothing wrong with that. Anyway, so I see her in my office. I look at her MRI and I'm just like, well, I don't see any reason why you can't have a lumbar disc replacement. That's what I would recommend for you. And she's obviously she's very happy with that. And we went through the whole process, and which involves insurance companies, right, to get her approved or authorized for this procedure. And it's always interesting how these things go. What you don't see is, I'll explain what happened. How about we'll start there. So the day before her surgery, and this is when these things always happen. The day before her surgery.
Yeah, why is it always so late? Why?
I don't know.
You're like literally just got the scalpel in hand.
It is the way that they do it. This is the way that they roll, right? So the day before her surgery, I'm doing a bunch of other surgeries, and right in the middle of my day, I'm like coming out of one surgery, and I always check my phone because other things are happening with patients, or something's happening at the office, and I get this text message from my surgery scheduler. And I remember looking at it like it was yesterday. I'm looking at it and I'm like, surgery not authorized. She literally took a screenshot of the authorization and sent it to me. Surgery not authorized, experimental.
Experimental? Like
And that was
in the 1920s?
Experimental. And so right away, I call my surgery scheduler. I've had the same surgery scheduler for the last 10 years. Like, she is the GOAT of scheduling surgery. She always gets it done. She's great at authorizations. And I asked her, I was like, experimental? We're like, okay, well, obviously lumbar disc replacement is not experimental. I'm sure we can. I mean, this is unfortunate. There's gonna be a delay here, but we've been here before. We could submit an appeal, and we can get this appealed. I can write a letter, and we can fix this. I'll just have to talk to the patient. And she says, no, I've already talked to the insurance company, and there is an exclusion in her policy specifically for lumbar disc replacement. It is experimental.
Why do they get to dictate that?
We will never approve this surgery. So, and those are the types of things that really, really upset me. I'll put it that way when it comes to taking care of patients, because what we have is doctors take care of patients and insurance companies don't. And insurance companies are playing doctor and they're dictating care. And there's nothing experimental about lumbar disc replacement. So I have a conversation with the patient. And one of the first, I call her and I explain what's going on. I wanted her to hear it from me.
Yeah.
I didn't want to hear it from my surgery scheduler. And one of the first things she told me, or she asked me, she's like, Dr. Sharif, she's like, why would you offer me a surgery that's experimental? And when she said that, because everyone doesn't know this insurance game, right? As being a surgeon, I hear this all the time. It's not experimental. Like, what are they? They're crazy.
But it's unfortunate, but it's to be expected.
It's to be expected. And I've worked around this so many times. But for her, it was like, my insurance company is telling me this is experimental.
Yeah.
And I told her, I was like, but you've done your research. Don't forget.
You came in here asking for this.
Yes. Like, you did your research. You know this is not experimental. Well, why are they saying experimental? And we went into that discussion about why, they were saying this was experimental. But so to answer your question, lumbar disc replacement has been done in Europe for almost 40 years, a strong 35 years plus. It's been approved by the FDA in the States for over 20 years.
Really?
This is not an experimental intervention, not in the least. And there's so many studies. Like, in medicine, we talk about randomized controlled trials. That's our highest level of evidence when it comes to stating whether something works or it doesn't. And there's so many random controlled trials that show that lumbar disc replacement is just a great surgery for patients. But you still have these insurance companies where, it's all about the dollars and cents.
Well,
So
I think
we struggle with that.
Well, we talked off screen before we got on the mic, and you said, like, I was kind of like, what's one thing you'd really love to change, whether it's perception or outcome or anything? And it's this fear of spinal surgery being the thing you avoid at all costs. Because Ash and I, with our patients, and we've seen it over our 20 years of practice, where you just don't kind of hear about the people that doctor recommends a nice surgery, they trust the doctor, they get a second opinion, they do the spinal fusion, and they have an amazing outcome, right? You hear every horrific story where, my uncle, and he gets paralyzed and all this stuff, and you're kind of like, really? Like, and they get online and they find all the worst outcomes. But it really is unfortunate, because we see so many people that just think, well, I've got to suffer for the rest of my life with back pain, or I have to stand up every 20 minutes, and just because I'll never do surgery. It's too invasive. It's too terrifying.
Yeah.
So is there anything else that you do? I mean, but you fight this battle every day. Would you say you shadow box this thing?
Oh yeah, I shadow box this every day. The conversation when it comes to that, I guess it kind of starts with this. So let's say you go to a restaurant, right? You go to that restaurant, you enjoy that restaurant, you've been going there for years. How many reviews have you left for that restaurant?
In and out, none, but I love it.
Right? There's so many places that we enjoy, and we recommend our friends and, go check out this place. But have we got online and actually left a 5-star review? Maybe not. But if you go somewhere and you have a terrible experience,
Food poisoning?
You'll make the time.
Oh, yeah.
You'll be writing that review in the restaurant.
I'll go to the man's house. Yeah.
So the people when people have a bad outcome, they're always the loudest in the room. And, one of my things is trying to change the perception of spine surgery. With newer techniques, especially endoscopic spine surgery, and that's something that
for people who don't know, what's endoscopic spine surgery?
So endoscopic spine surgery is something that a very small number, in the scale of spine surgeons, a handful of spine surgeons are offering these days.
Like Mayo Clinic, Chicago, like bigger markets?
So yeah, probably some bigger markets, some academic centers, you'll see it more, but still, most spine surgeons have not adopted endoscopic techniques. I'm one of the only ones here in Vegas that's offering endoscopic spine surgery. In endoscopic spine surgery, before I tell you what it is, I'll give you an analogy. So let's say you locked your keys in your car, right? Keys are locked in. You want to get those keys out. You want to continue your day. This is really messing up your day, right? Now, there's a brick laying on the sidewalk. Now, you could grab that brick. You could break the glass. You could get your keys. But then you've caused all this damage. However, alternatively to that, you could get a locksmith. And the locksmith can sneak in, maybe through that, crack between the window and the rubber to the seal and get something down in there, or put something in. Yeah, get a little Slim Jim action and take care of the same problem, but causing less damage. And that's really what endoscopic spine surgery is. You're sneaking inside the spine like a covert, Navy SEAL, ops, and you're taking care of the problem. You're taking out the bad guy and leaving very little collateral damage. Spinal ninja.
Okay, so there you go.
Got one back.
There you
We're
go.
really excited about that.
I had to get that in there. That felt right.
So I'm making incisions smaller than a dime. So we're talking 5, 6, 7 millimeter incisions at max.
Between the layers.
Yeah, and we're taking a tube the size of a number 2 pencil, and I'm able to go down into the spine. I can find the disc that's irritating the nerve, and I can decompress that nerve.
Decompress meaning
take the pressure off the nerve. So
cutting it.
Yeah. So we're basically just taking away the disc herniation. Think about a disc herniation like jelly coming out of a donut, right? Yeah. So the jelly is on the outside of the donut and it's irritating the nerve. So I'm just cleaning up the mess.
Shaving it off.
Yeah, I'm just shaving it down, cleaning up the mess and taking that pressure off the nerve. And you're doing that surgery so discreetly with really just minimal tissue disruption. And that patient goes home the same day. Matter of fact, so when you do new things, right, there's got to be a first patient. There's got to be a patient 0.
Not me.
Do they know? Do they know that they're patient 0?
Oh, I told him he was patient 0.
Okay. All right.
Yeah. So it's interesting. So I didn't know that I was going to do endoscopic spine surgery. I was doing minimally invasive, doing the whole robot thing. I'm the robotic spine surgeon in Las Vegas, minimally invasive.
Still are, but just
I am, but now I've taken it a step further.
Okay.
So now we're ultra minimally invasive. And I trained with a well-known surgeon in San Diego, and I met him at a conference.
Who's that?
His name is Cho Kim. Great guy. Check out his Instagram too.
Okay.
Now, he is the spine ninja. I saw the things that he was able to do with endoscopic spine surgery and these techniques, and he made me a believer. I saw the outcomes. I saw how he was sneaking in there, taking care of a problem, and patients backing out. Patients are getting better. And I thought as I'm watching him do these surgeries, and I went down several times to San Diego to watch him do these surgeries, and I'm watching him do this, and I thought to myself, if I'm gonna have spine surgery, give me the scope first. I want this. Try to get it right with the scope, because we are preserving anatomy. Mm-hmm. I can sneak into the spine without doing a laminectomy, without cutting bone. I'm going through a passage that naturally exists in the spine. Like the nerve comes out above, and I'm sneaking under the nerve and getting to the disc.
You know what? I got to jump in. I've taken so many depositions of doctors. There was an orthopedic surgeon, Dr. Herr, and I was coming at him. And I'm asking him about a knee surgery, and he said, look, I always tell patients, I can never get you as good as God made you. Mm. And I never heard that before, but he said it with such kind of authority and passion. It kind of stuck with me over the years. And I always think about that when I'm reading some article about, surgery really the best option, and would you be better off just doing physical therapy and strengthening and whatnot? Yeah. But the less you can remove, the less damage you can do, go in there minimally invasively, right? And then do minimum damage. Like it tracks that you're going to have a better outcome because you're not messing with what God gave you, right?
Absolutely. I mean, you are going in there with like laser type precision. And at the end of the day, it's all about the outcomes for me, right? So I get half patient 0. I'll go back to that. Half patient 0. I explained to him, well, let's go back. Why did he need the surgery? He had severe leg pain. He's a very actually prominent personal trainer here in Las Vegas, and he literally couldn't walk. He couldn't train his clients. He couldn't do anything. He came and saw me. He was using a walker. This guy's like mid-50s. When I tell you, he is sliced and diced, like shredded. Obviously, he takes care of his body. His body is his temple, and he, when I saw him and I told him he needs surgery, he was all about it. And that's how you know someone's really struggling, right? Because a guy like him, you would think that he wouldn't want anybody operating on me.
He's going to be I'm the last guy to do
Yeah, something. I'm a holistic type of guy. Yeah. He seemed like that type of person, but he was struggling so much that I said, you know what? So I said, you need surgery. He's like, no, I want to have surgery. That's why I'm here. And I told him, I said, because of where this disc herniation is, it was sitting right behind the facet joint. So the facet joint's in the posterior aspect of the spine.
Posterior back.
The back part, right? And the disc was protruded, but it was right behind the facet joint. That's not where disc herniations usually are. They're usually in an area where you can get to it without taking a lot of bone. But when it's right behind the facet joint, you actually have to remove the facet joint itself to get to the disc herniation. And guess what you need after that when you remove the facet joint? You need a fusion.
Yeah.
So that's what I told him. I was like, well, because of where this is located, you would actually need a fusion for this type of decompression. There's really no way around it. And he asked me, he's like, there's got to be another way.
Oh, he pushed
There's
you.
got to be
Challenged
something else. I'm not having a fusion. Like, I want to walk. Obviously, you see, I feel like my legs starting to atrophy. I need to do something. But he was like, I mean, I want to be able to squat. I want to be able to be active.
Yeah.
He's like, I just don't feel comfortable
Yeah.
with having implants in my body.
Challenged you.
And then, you know what I thought about? I said, well, I've been training with a surgeon, and I feel confident that I could do an endoscopic spine surgery on you, and we could avoid a fusion. Because with endoscopic spine surgery, what it's allowing, you can sneak into the spine through that area that I was talking about, under the nerve, into the foramina, where the nerve comes out. You sneak into that area, and you don't have to remove the facet joint. So I was able to do that surgery on that gentleman and help him avoid a fusion. And he was patient 0. And the reason that he signed up for it, because he said, I don't want a fusion. He's like, this is the first one you've done. And I told him, this is the first one I've done, but I'm confident I can do it. I've done the courses. I've trained with someone that's a world-renowned endoscopic spine surgeon. And you check all the boxes. I believe that I can get you better. And he trusted me. I did the surgery. This surgery took, it's my first time doing it, in the operating room on a live patient. I've done, cadaveric training and things like that. I've done the surgery several times, but this is the first time I'm doing it on one of my patients. That surgery took hours. It's so much longer than it would take me now.
Your back hurt.
It was so, right? I was so meticulous about it. I just, I was taking my time. I just wanted to make sure everything was done right. I didn't want any complications, obviously. Wanted to get this guy better. He really trusted me to be my first patient. That meant a lot to me. Mm-hmm. So surgery went great. I felt like I got a really good decompression of the nerve and trimmed down the disc. But you don't know until you know.
Yeah.
So the next day, I call him. And I don't call everybody the next day after surgery, but I called. Of course I was. Are you kidding me? I call him, and the first thing he says to me, I'm so glad you called me. This is really weird. I'm like,
brace yourself.
Weird.
I don't know if that's the word I was going for.
Yeah, weird. Weird to make me nervous.
Right? That's not what I was looking for. And you know what he says? He says, I don't have any pain. Is that normal? I don't have any back pain.
Die?
I don't.
Am I gonna die?
Is this heaven?
Are you alone?
He has no pain. He's, I don't have any back pain. I don't have any leg pain. He's like, maybe my back feels a little tight or something like that. And I told him, I was like, well, this is ultra minimally invasive spine
like
surgery.
2.0, baby.
Yeah. And it's the outcomes like that. Like, that's what drives me more
You
than
got
anything.
the phone and you're like, yes.
You did a little air guitar.
Hey, that's my last post. So I'm calm. I'm very calm. I have I'm very composed in the operating room, but not only that, in the office. But inside, I am fist pumping. I am so.
Oh yeah.
I like every outcome means so much to me.
Yeah.
So as I was saying earlier, I think a lot of surgeons, what really motivates them or what drives them as far as surgery is actually doing the surgeries, which I love. I love the surgeries. But what really gets me up in the morning is the outcomes, is changing someone's life. That's what really motivates me.
Well, I tried to penetrate that a little bit with my skeptical attorney questions before we sat down, and I was 3 or 4 deep, and I'm like, no, okay, he's genuine. Like, no, and it's and that's good. You want your doctor to care beyond just the paycheck. And kind of not get to that point where they've done it so much in the same type of surgery that they're not innovating, they're not doing the continuing education. I was just reading some book and it was talking about really science is the opposite of like definitive answers, and it's just constantly iterating and abandoning old ideas, right? Talked about Einstein, and he'd fight with these other physicists about these things, and then after years he'd go, okay, fine, you're right, like you're right, but he never held on to those beliefs so tightly that he wasn't willing to change. So do you look around your colleagues and kind of just go, guys, like, you don't have to do it overnight, but like at least come to this conference or like hear me out. And is it falling on deaf ears? Is there just always going to be people like you that are disruptors and want to change that? Like, what's the way to like get people on board with this stuff? Because I see as a problem as an attorney, Ash, I'm sure could jump in here too. Like, people don't want to do spine surgery. It's terrifying. They think it's just a fusion or nothing.
Right.
They don't know there's options.
Right.
So what can we do?
I think education is key. I think that research is important. Surgeons, doctors, we respect research, and we respect experience as well. So when they see there's just more and more evidence that's coming out that's showing that endoscopic spine surgery and minimally invasive spine surgery is very efficacious for patients. And it's not so much that, if you do an open surgery on a patient, and I'm not knocking open surgery at all. I did open surgery for years.
Open, sorry,
so making a traditional midline incision, open up the spine, seeing the anatomy, decompressing the nerve, those things work as well. There's no doubt about it. However, it's like, how do you take a patient from a certain where they are, and how do you take them to where they want to be, and what are they going to have to go through to get there?
Well, it's the brick, right?
Yeah.
You got the keys, but what did you break?
Exactly. So it's just,
I'm fixing my window.
Right. So what I see in my office is, and that's what kept motivating me to keep going with the endoscopic, keep going with the minimally invasive robotic surgeries, even though they were taking longer, and I'm doing less surgery for the day and this, that, and the other. But at the end of the day, it's the outcomes. That's what motivates you. That's what kept me going and say, this surgery just took 3 hours. It used to take me, 2 hours or an hour and a half. But the patient outcomes, they're coming in, they're off of those pain medicines, they're going back to work faster. That's what keeps you motivated. And I think just in general, my personality is I'm a person that I feel like I'm always kind of learning and changing and evolving. And I think, if I saw myself, like my younger self saw where I am right now, and what I'm able to offer patients, I would be so proud of the transition and the evolution that I've made over the last 10 years. This is exactly where I wanted to be.
Well, and that's what all the self-help growth books talk about, is like, you don't want to be able to look back over the year and be like, I'm the exact same as I was. I think the same, I eat the same, I act the same. Like, we should be making those constant changes. So yeah, it's just good to hear that. And I don't, there's not a simple solution.
Well, I think what I'm hearing you say is that it's just going to take time, right?
Yeah.
I mean, the legal field is very slow to change as well. It took us forever to be electronically uploading our documents to the court when everybody else was doing it. So I think it takes seeing good outcomes over and over again.
Yeah.
It takes doctors being willing to slow things down to learn.
Yeah. And that's hard to do. Right. I can understand that you've been doing something for 20 years and now
to abandon that.
To abandon it, especially when you're like, in my hands, the patient gets better with this.
Yeah.
Right.
And it's worked. Yeah.
It's worked, and now you're changing things, and you're going to courses and this, that, and the other. There's definitely some investment that's involved, some personal investment and improvement. And I think that's one of the barriers. But you know what? Guess what? So one of the other barriers we touched on earlier is insurance companies. Is endoscopic spine surgery authorized by insurance?
Oh, yes.
Many consider it experimental.
Well, and this is what we run into when we talk to doctors, right? I went around campaigning for my son to figure out if med school was for him. And they're just like, the fact that everything's dictated, especially the prices, by insurance companies, it's just put people off. And they're like, find something cash pay, find something elective, get out of any space where insurance is going to be the one pulling the strings. And it's very frustrating. Like, I have these conversations with doctors, and it's extremely infuriating.
Absolutely.
Yeah.
Absolutely.
It's also sad for the public, because then it becomes health to only those people who can afford it.
And the public doesn't see that what's kind of going on.
No, and I think more recently the public is really become more privy to some of the practices of the insurance companies. Like we've seen some things in Congress, we've seen some things happen in the news and social media.
Well, I have to say, like, I don't think people actually acknowledge how, I mean, think about who are the biggest advertisers. Super Bowl TV. Who do you see constantly?
Right.
Like a Good Neighbor, State Farm, all these messages of like, we're out to take care of you. And I think it's hard for uneducated people to acknowledge, like, they don't care about you.
No,
you are a number.
They're taking care of their shareholders.
Right. Yeah. And they're the biggest business.
That's their biggest obligation, actually.
We have to explain this to our clients. It's like, listen, we're waging war here against some of the biggest and most powerful companies in the world. So like, they're not just going to roll over, and you're going to run into obstacles, right? So yeah, it's I don't know if it's a fair fight, but it's a fight that's worth, engaging in for sure.
Yeah.
I want to pair things back. I know that you're the guy that cuts. You're kind of the final stop on the road. But selfishly, I'm 37. I've been hunched over a computer for 20-something years. What would you say to people about their spine health as they're aging? Like, what should they be doing? When should they be seeing you?
Yeah.
And what should they be doing before they see you?
This kind of almost goes against, a selfish desire. I want everybody to come and see me.
Yeah.
But at the end of the day, you should do whatever you can to stay out of my office.
Okay. Tell us what that is, though.
One of the most important things is number one, if you're a smoker, stop.
Okay.
For all the other reasons you should have already stopped. And we see it so much, especially in this town, right? We have a lot of smokers here, and I have a lot of smokers come to my office. And what I see with smokers is premature disc degeneration.
And just simplify everything.
So basically, what smoking does is it damages the blood vessels that supply nutrients to the disc, right? And it also it gives free radicals, these things that basically just cause degeneration, like all these different chemicals that are in the cigarettes.
They break down
the disc. So when you're breaking down the disc, it's like you're getting older faster, right? So you have a patient that's a smoker and they're 40 years old. You look at the disc and you're just like, wow. I mean, I've seen a 60-year-old person with a disc that looks better than yours. So
and I've had doctors like you point to an MRI and show me like a healthy disc should look like a plump sausage, and then you should see the unhealthy one that's kind of pushing out on the sides, and it's lost that, what do you call it, viscosity, or like it's just dried out, it's degraded. You don't want to see that, right? And the smoking just kills it.
No, it just kills it. So you see premature disc degeneration, right? The other things you want to avoid, believe it or not, is sitting for very long periods of time. That's why it's important to get up and move. Your body was meant to move.
Yeah.
And when you're sitting for long periods of time, especially in a more hunched over position, like you're bending forward, like we're not engaging our posterior chain, right? And you're putting a lot of pressure on the disc.
Yeah.
You're putting a lot of pressure on the disc for long periods of time. And that can lead to issues down the road. And then one of the most important things to do.
Can you reverse that? I'm 37.
Can you reverse?
I've been sitting a long time. I've been hunched a long time. Can you reverse it, and how?
Exercise. Exercise is probably the best way to mitigate that.
Muscle strengthening, like with weights, resistance.
Absolutely.
Weights.
Bands, yeah. So working on those muscles that help to support the spine. I call it your God-given brace, right? I have patients that come to my office and they want a brace. Like, my back hurts. I feel like I need a brace. No, God gave you a brace. You just need to develop the brace. Okay? It's like God gave you a talent, but you're not using it. Like, you need to develop your brace. And, that can be, for the lower back, it's the deep muscles that help support the spine. It's the paraspinous muscles.
It's all
for
there.
The upper back. Like, you have what you need, but you have to engage it. And the other thing I think is important to stay away from as much as possible. I mean, obviously, we live in a world where there's processed foods everywhere.
Yeah.
But processed foods have been shown to cause inflammation. right? And inflammation can affect our spine. It can affect the disc. It can affect the joints. So that's something, we need to be health conscious about our bodies in general and trying to avoid these things that can cause unneeded inflammation.
Let me go back to what you said and tell me if you disagree. You said posterior chain, which is just a fancy way of saying, in my opinion, all the non-vanity muscles, right? Maybe not the glutes, that's a vanity one, but
yeah,
the hamstrings, all of the, scapular rear kind of deltoids.
Yes.
I always tell people the best thing you can do is shoulder pulls, any kind of pull
rear
motion,
deltoid,
right?
Yeah, that's one of the most underdeveloped muscles.
We have to fight that desk.
Always
punch.
doing this, exactly.
So even my wife asked me, and so now she does the bands.
So for you, rear delts.
Yeah,
pulling,
face pulls.
Yeah, face pulls, gall crushers. Like, that's what you want.
Yeah, that kind of stuff is the only thing you can really do to kind of get those muscles,
get those shoulders back,
get the shoulders pulled back.
Yeah. So even for people that work out, I mean, they'll do bench like 2-3 times a week or whatever. Everybody loves to bench and work the chest. And you end up it pulls everything. You gotta work the rear delts and those upper
Supermans are great.
Mm-hmm.
Yeah. So
absolutely.
But yeah, I'm glad you asked that because there's just everybody's got low back pain. It seems like you get the memes where it's like if you get this reference, you got low back pain, right? And I'm like, oh, that's me.
Yeah.
And I have it sitting here right now. Like I'm changing my posture because I've been fighting this from a rear end collision and probably being way too active. But I'm glad you asked that question because I think people just need to know, like, okay, what can I do to avoid ever having to have the conversation with a surgeon? Mm-hmm. And I joked about Pilates, but like when you say yoga, Pilates, those things are
I think yoga
as you get to the fountain of youth.
Yoga is great for the spine. Yeah. And I think the other thing that's important to know is like, there's areas in our body that just don't have a great blood supply. Mm-hmm. And one of them is the spine and the disc. Yeah. Mm-hmm. So actually mobility, like moving around, is helping to diffuse nutrients into the joints, into the disc. So that's why being very sedentary is, you would think like, oh, I'm being sedentary, I'm not really using my body much, there should be a whole lot of wear and tear. No, it's actually really bad for your body. Your body was meant to move. A spine in motion should stay in motion.
Yeah. Motion is lotion.
Yeah.
What about, does your practice ever bleed into any kind of regenerative stem cell? That's all the craze these days, peptide stem cells. Do you have an opinion on that stuff?
That's a great question. And I think for the most part, the jury's still kind of out. I think there's some things out there that are very, very promising. And I've had some patients that have had, stem cell injections and have done some things and they've seen some benefit from it. But I still think that...
skeptical though?
I think we should always be skeptical. I think it's important to be skeptical, especially when new things come on the market. But at the same time, I think we should embrace, new technology and new ways to help patients. And I think that soon, I'm definitely exploring some things with my practice. And I do want to start offering alternative treatments such as, peptide therapy, PRP, and possibly even stem cells as well.
Yeah. I can just say, gym bro conversations, there are some passionate people with the peptides when they do the self-injection of the 157. They're like, it took away my elbow pain or this pain.
157.
More so than like PRP or stem cell, where I think it falls into that category of like, who knows? Was it just the fact that it took more time and your body healed? Mm-hmm. But I don't know. The peptide thing, there's got to be something to it.
Yeah, I'm definitely starting to explore that a little bit, but I just want to do more research on it so I can feel more confident in recommending it to my patients.
Okay. Any other misperceptions or conceptions out there about spine surgery, robotic spine surgery that you haven't touched on that you're like, what, I'd love to make sure our listeners leave with this understanding. They had this belief. Let me shatter that for you.
So I want to make spine surgery less scary. There's certain spine conditions that have been treated the same way for years. And I'll give you an example. If you have a large thoracic disc herniation in your thoracic, a disc that's in your mid-back essentially, in your mid-back, that's where the spinal cord actually exists. The spinal cord is in your neck, it's in your mid-back, and then when you get down to the lumbar spine, it's mostly just nerves. So this is a disc herniation that's pushing on the spinal cord. It's typically causing really severe symptoms, what we call myelopathy or dysfunction of the spinal cord, where your legs feel wobbly, you have numbness and tingling, the legs aren't as coordinated as used to be, you may have weakness. Those surgeries used to be surgeries where even if you had symptoms and maybe they weren't so severe, maybe they were just like kind of mild to moderate, a spine surgeon would tell you is like, because of the risk involved with this surgery and the magnitude of the surgery, you should wait until you just can't deal with this anymore. and then we can do something about it. And that's because that surgery used to involve, you know, big incision, taking down a rib, removing a part of a rib, having to put a chest tube in afterwards, and just months and months of recovery. Jeez. So the brick through the window to get the keys. But with endoscopic spine surgery, this is a surgery that can be done outpatient now. These patients can literally leave the same day and get back to their normal activities within 2 to 4 weeks. So, I mean, when I say that endoscopic spine surgery is changing the game, I mean, it's like, you know, I don't know, like Super Nintendo to PS5. I mean, it is changing the game. This is a different type of experience for patients. Yeah. And they don't have to wait as long. You don't have to wait until you can barely walk to have spine surgery. Now that's an extreme example. But even when it comes to disc herniations and pain going down your leg, and people come in the office, I've been having pain down their leg for 3 years. You've been struggling with this. This has been changing your quality of life. You're not doing the things that you want to do. And what that does, it holds you back. It even changes your identity some.
And relationships.
Right. They can't play pickleball. They don't have that social identity anymore. They can't do this, that, or the other. And what I'm saying is that we can offer surgeries. And, you know, you have to vet your spine surgeons and see what they're offering, obviously. But surgeries can be done. Surgeries can be offered, which carry very low risk and that have predictable outcomes, small incisions, big results. That's my mantra, actually. It can get you back to doing the things that you want to do sooner rather than later.
That's awesome, man. As we wind down, you're a super high functioning, efficient individual. I think our listeners would love to hear like one of your crazy busy surgery days. Like you wake up at 3 a.m., whatever. Like, let's hear your crazy day. Are you doing the like ice water that's filtered or like, like that guy? Like, what's it like for you?
Yeah,
like,
I'm not that
in the bowl.
I mean, I look at a guy like you and I'm
fancy.
like, this guy's either on crack cocaine 24/7 or he's just got a gift. But I think you got a gift. Like,
I have passion. This is
okay. You're running on passion.
I'm running on passion and selfless.
Passion. Tell us about a day though, like day in, or your morning routine. I want to hear your morning routine.
So my morning routine is pretty basic. I get up. I get up. I'm probably up. I wake up probably. I don't need a lot of sleep. I'm one of those people.
Ugh,
I go to bed around. Maybe I shouldn't say this. I go to bed probably around like 11:30 to midnight every night.
You just lost patience.
And I'm up at 4:45. My alarm goes to 4:45.
You gotta be kidding me.
Every single day. As long as I get about 5 hours of sleep, I'm pretty good. I'm pretty good on 5 hours.
Okay, that's
DNA. Yeah, so I'm up. I do the whole bathroom thing. I'm getting ready for work. I say a prayer. It depends on the day how early I'm getting up, but I try to like wake my kids up so they can see me before I go to work because I'm usually working a really long day.
You got how many kids?
I have 3 kids.
Congrats.
I have 3 kids. And then after that, I'm headed to the gym. So I probably get to the gym. I'm probably at the gym around, I don't know, 5:30, 5:45, something like that. Get an hour workout in, and then I'm headed to the hospital. Look over the preoperative clearances, make sure everything's locked in, look at my preoperative MRI scans and all that kind of stuff. I'm talking to the patients, I'm talking to staff, make sure everything is set up for the surgeries for the day, working with my rep, making sure we have all the instrumentation that we need and everything's ready to go. And on busy days, I'm doing 6-7 surgeries a day and I'm just doing them back to back. And, I have a protein shake in between. And, if things slow down a little bit, maybe I'll go to the doctor's now and grab something to eat. I'm typically done by around 5 o'clock. Okay. My son plays baseball, so it's baseball season right now. So I try to get to his game and hang out with the fam at the house, and then rinse and repeat.
I want to talk about that a little bit. You're a phenomenal doctor, but you're also a big family guy.
I am.
Became a doctor, are continuously learning how to do new things, going to San Diego, training with people. Yeah. How do you manage being the family guy that you are and becoming a doctor?
Well, that conversation has to start with this. My wife does the heavy lifting. I'm her assistant, right? And it's been that way for a long time. I mean, we've been together since residency. So, and we had our first child around the time I started residency as well. So we've been doing this, and we're a great team. We're a great team. And she keeps me on my toes and where I need to be and what I need to do, and I show up. I really enjoy being a dad. Like, that's definitely one of my passions as well. And just watching my kids mature and grow and learn new things and have these goals and challenges, and then watch them meet them and surpass their even what they thought they could do. It's just amazing.
Yeah.
So it's that motivates me as well, and that kind of keeps me going. And then at the same time, I kind of feel like what I do as far as being a spine surgeon, I'm making them proud.
Oh, good.
Right? Like, my kids they're like, yeah, my dad's a spine surgeon.
They're proud.
They ask me about things when I come home.
I'm proud.
Yeah, that's
they're gonna like this new house.
Really rewarding. That's it.
That is rewarding, man. Well, I gotta say, before I kick you back to Ash for the final question, I gotta say, I've appreciated just getting to know you a little bit. I mean, I knew you before this.
Yes.
Knew of your reputation. We've had patients that you worked on, and I've got to hear the outcomes through them, and only been great outcomes, right? And it's nice to be able to refer to doctors where it's like, listen, the bedside manner is going to be there, but also the skill and the care and all those things.
So important.
But no, I just got to say that I appreciate the fact that, consistent with the Attorneys on Accident theme, is we want to have people on who are disruptors, innovators, people that are trying to elicit change and do something more than just sort of exist and get through, right? But I see what you're doing as just, a humble endeavor where it's like, look, I don't know everything. I'm open to new things. Even when I asked you about the regenerative medicine, you could have been like, oh, that's so stupid. And that's that. Like, I appreciate that. I hope that spreads and that you can kind of help the medical community in Las Vegas, because Ash and I, you'll hear us griping that, or you'll hear people say all the time, I got to go to California if I want a real doctor. I got to go to Phoenix, or I got to go to Chicago or back to Maryland. And it'd be really nice to see people like you become more of the norm and not the exception, to where Vegas starts to get this identity of like, oh no, you can stay here. You don't have to leave for that confidence, right?
Yeah.
So I appreciate that. I mean, any final thoughts?
So that's definitely been one of my endeavors since I've been here. I didn't know this whole reputation of Vegas and medical care. I had no idea. I thought I had an incredible opportunity. So I came to Las Vegas. I didn't think I'd be in Las Vegas. This wasn't like a plan or anything like that. I think my wife and I knew we wanted to be, kind of on the west side of the country. But I just came here because I thought I had an extraordinary opportunity to help and to join a practice where I'd be able to flourish. But yeah, that's so. Since understanding that as being here for a while, there are really good young physicians in town that are really trying to change that stigma here in Las Vegas. I just the other day, I'm coming out of. There's this place called Wrap It Up. I don't know if you ever heard of it. Yeah, it's in Henderson, right outside of Henderson Hospital. They know me really well in there, and they give me a discount, so I always go there. So
we're Summerlin snobs. They don't go to Henderson.
Oh, no, you don't. Hendertucky. Okay, I got it. So I got my wrap, right? They do these tostitos. What is that? You know what I'm talking about?
Chip tostado?
No, not the tosti. It's
pizza roll.
Taquito. So it's called Wrap It Up. They do taquitos.
Got it.
Right. So I'm leaving there. I got my taquito and I'm coming outside, and this lady, and I'm, obviously wearing my surgeon hat and I got the scrubs on and everything. And this lady stops me. She's like, excuse me, I just want to ask you like a weird question. I hope you can answer it for me. Right. Actually, I was on foot. I was just walking.
Oh, right.
I was walking to the hospital. Anyways, she says, she's like, what do you think about the medical community here in Las Vegas? Just a random person on the street, right?
Oh, man.
Yeah. She's like, I'm from LA and we're thinking about moving here. And I just heard the medical care here is not what it is in LA. And I was like, you know what? I said, I can't speak to LA. Obviously, it's a bigger community and there's probably a lot of surgeons and opportunities and, that to see, different people for your care, no matter what it is, right? And that's important too, to have a lot of options. But I told her, I was like, I think that's a stigma. And I think that it's changing. I think it's evolving. I think there's a lot of great surgeons here. Even there's a lot of great older surgeons, but a lot of newer surgeons as well that are using, newer technologies that are bringing things into the valley based on their training and are trying to change that perception. So I told her, I was like, ask around, do your research, but there's good physicians here.
Yeah. Absolutely.
Awesome. What a great way to close it out. It's been powerful. It's been cool. It's encouraging. If anything, I'm feeling like, okay, There's some hope for the
Change is
future.
coming.
Change is
It's
coming.
coming.
One Dr. Sharif at a time. Ash,
All right. So you're a surgeon, you're an innovator, you're on the cutting edge of brand new technology. Do you think you got where you are on accident?
No,
Tell me
not
about
at
it.
all. So this is my ministry. This is how I give back to society. This is exactly where I'm supposed to be. There's like no doubt in my mind. I touched on earlier, like, finding that piece, that space, being that piece that locks into this puzzle that we call life. And when you're locked into it and you're in your space, it just feels right. And it's not always easy, right? But it just feels right and it feels good. And I know I'm exactly where I need to be.
Yeah.
Like when I was growing up, I grew up in a single parent home, and my mother and I would have conversations about, goals and dreams and aspirations. And I didn't know I was going to be a spine surgeon. And she never pushed me into medicine at all. I just knew I was good at science, and it just kind of evolved in where I'm at today. But all these little things that happened along the way, the people that I've met, the mentors that I've had, I just know where I am today is not by accident. This is where I'm supposed to be.
I picked up a little bit of like some faith, but that's another episode.
Absolutely.
I'd love to have you come back, talk about how much your faith has formed you. But thanks for coming on. Thanks for your time.
Thank you. That was
Super
amazing.
just insightful and giving me some things to think about. And I certainly hope that your message will spread across the world, and people will hear this and kind of go, you know what? Let me maybe get that second opinion. Let me find out more about this endoscopic surgery or robotic surgery and start to make that and elicit that change.
Absolutely.
All right, man. Thanks, Dr.
I really appreciate you. Thank you so much for having me on.
Yeah.
Great
This has been great.
conversation. Thank you.
Thank you.
Hey friends, before you go, make sure to like and subscribe to the Attorneys on Accident YouTube channel and check out another video for more conversations on growth, business, and life.